The special newscast at 7 p.m. with Pia Knob and Angela Knaus. Good evening, ladies and gentlemen, and welcome to our exclusive newscast. Today we would like to deal with an important topic, the coronavirus disease.
As many have already noticed, COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like a cardiovascular disease, diabetes, chronic respiratory disease and cancer are more likely to develop serious illness. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette. After closing from the evening of 5th of April 2020, the WHO signals 1,093,349 confirmed cases in 209 countries. Additionally, 58,620 confirmed deaths, and the figures are continuing to grow. With 15,000 people, Italy has the highest number of deaths due to the virus infection. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments and they are still in confidence.
There are also many open questions about COVID-19. Therefore, we invited Dr. Frederik Siebert, Director of the Institute of Virology at the Charité in Berlin. He will answer the most important questions that were asked by the population on our website. Welcome, Dr. Siebert.
Dr. Siebert, in these difficult times of COVID-19, it is really easy to frighten the population and disseminate fake news. What do you think about humans' opinion to wear mouthguards for better protection in public?
Mouthguards are actually designed to protect people from getting infected when the wearer has an infection. According to the WHO, wearing a mask in situations where this isn't recommended could create a false sense of security. This could lead to the fact that central hygiene measures, such as good hand hygiene, are neglected. The RKI recommends good hand hygiene, cough and sneeze etiquette and keeping distance. This is how you can protect yourself effectively.
What should I do if I suspect that I am infected?
Anyone who has had personal contact with a person who has been diagnosed with the virus in the laboratory should contact the health department immediately, by phone, even if there are no signs of visible disease. Anyone who has been in a risk area, even if there are no signs of visible disease too, avoid unnecessary contacts and stay home if possible. If symptoms like cough, runny nose, sore throat and fever appear, you should only visit the doctor's office after prior appointment.
Are the clinics about to collapse due to the virus?
In many countries, health systems are under scrutiny. Hospitals in northern Italy are working at the limits of their capacities. The same could also happen to German hospitals. Whether our health system resists pressure depends on the spread of the virus. The patients are just not allowed to come all at once. Compared to Italy, we have 2.5 times as many intensive care beds per 1,000 inhabitants. Now it is a matter of using this resource sensibly, and for that we have to make sure that the number of infections does not grow so quickly. The caregivers are under great pressure too. In addition to high workloads, many would be afraid of falling ill or unconsciously infecting others with the virus. In order to get through the pandemic lightly, the population has to think along and not to put stones in each other's ways. However, the real challenge is now to have enough staff to guarantee the treatment. There are options such as vacation blocks and cancellation of business trips.
Due to the spread of the coronavirus in Germany, there are also increasing restrictions on the labor market. The health of employees and employers is a top priority. What consequences under employment law do these restrictions have and how they impact is explained in the following interview by the entrepreneur Mr. Struck and his commercial trainee Mr. Weger.
At first, thank you for giving our viewers an insight into the effects of COVID-19 in your company. Over 10,000 companies face existential problems due to the crisis. Would you like to tell our spectators how this virus affects your company and your employees?
In the current day-to-day operations, everything revolved around COVID-19. Most of the stores in Germany had to stop operating temporarily. Others tried to bridge the crisis with home office. Unfortunately, we were forced to lay off good workers and other short-time work.
How quickly can short-time work be introduced and how long can short-time allowance be paid?
Short-time work can be introduced by the employment agency at very short notice. Many companies are unable to operate at full capacity, or the business ordered by the authorities to stop operating. And then the employees, in fact, may be entitled to receive the short-time allowance. The short-time allowance can be granted up for 12 months. If short-time work is interrupted for 3 months or longer, it must be displayed again.
Under what conditions can employees arrange home office?
Without a specific agreement, the employer is generally not entitled to the fact that his employees also do home office. If the company has to close temporarily, a corresponding relation in the employment contract is important. Otherwise, only agreement with the employees could help.
Are employers allowed to require employees to work overtime if many members of staff are absent due to illness?
Overtime is when an employee works more than the agreed normal working hours. In principle, employers only have to work overtime if a collective agreement, a firm-level agreement, or the employment contract requires to do so. However, a secondary obligation to work overtime can also exist if the overtime will prevent the employees from suffering damage which cannot be averted in any other way. This could be the case if, for example, large numbers of staff are absent because of COVID-19.
And that was our special newscast about the effects of COVID-19 on the business world. Thank you for watching and stay healthy.